This segment sponsored by Maryland Medical First.
All right, guys, this is a one-stop shop for all of your medical needs. Dr. Bharaj is here to tell us more about what they offer and Expo resources. How are you, doctor?
Oh, doing well, thank you.
Good. So tell us about your facility. This is like a one-stop shop for all of your healthcare needs, right?
Sure, yes it is. Maryland Medical First, we are a outpatient primary care center where we do adult medicine, where we treat patients from 18 and above, up till 100 years old patients.
Oh, wow.
And we provide all the primary care services. And if any at point in time during this care that if they need hospitalization, if they become sick, then we can follow, or one of our physicians, team physicians, can follow them at the hospital that they get admitted to. Our practice primarily is affiliated with the MedStar hospitals, primarily being with Good Samaritan Hospital. So within the proximity of our clinic, if you end up being admitted at the hospital, there we can follow you over there too. And upon discharge from the hospital, if you need skilled rehab care, then our physicians and mid-level providers can follow you even of being admitted to those facilities, and then you're back to our office care. So that's pretty unique in these days, that where practices mostly are confined to either doing outpatient versus inpatient versus doing only the skilled rehab care. So we provide care at all the levels, right from the outpatient to coming back to the clinic in that criteria.
Nice. And you also are a wound care expert, right? Give us some details about that.
So, yeah, I'm a wound care expert too, where we take care of a lot of complicated wounds like diabetic wounds, vascular wounds, and these patients, as they are all in the geriatric age group, with aging itself causes a lot of vascular problems, and that can lead to venous wounds or arterial wounds or pressure ulcers. So I have been, involved with the wound center at the Good Samaritan Hospital.
Nice.
And so any of the serious patients that need surgical debridements can be done over there and can also be followed in the outpatient setting also.
Nice. And Maryland Medical First also has an incredible staff. Give us some more information about that.
Yes, absolutely. We have at least about 4 to 5 medical assistants to the receptionist staff. Then we have the office managers and the practice administrators. So we all work as one team, and the whole goal is to, take care of our patients in the community. Whether you, especially when a loved one is sick or is dealing with a chronic disease problem, and they are all coming into the office to kind of support them and, be available for them, whether it might be as simple as having a prescription being called on the weekend versus a loved one has been diagnosed with a really serious diagnosis and now needs the support. And so our staff is, very, very supportive and available, from that standpoint.
That's fantastic. And it really changes the entire overall experience when you do have that one-on-one interaction. Don't you agree?
Absolutely.
And you guys will be at the Be More Healthy Expo this weekend. Are you excited?
Yes, we are.
Yeah. Will be providing us with some resources and some information there.
Absolutely. We're going to be focusing on also to talk about, and share and education materials about hypertension, which is again one of the chronic disease managements, and also to be also checking random blood sugars on the patients who would be interested to, checking their diabetic status. And also to talk a little bit about, vaccinations.
Yeah.
That is so important, especially whether it might be a flu season or it may be, the pneumonias, or, we're talking about shingles. So a little bit of an education on those topics too that we would be focusing on.
Good conversation, good resources. Well, thank you so much, Doctor. It was a pleasure chatting with you.
Thank you for having me.
Yeah. Okay, guys, up next, part of